During this webinar, you'll be hearing from Dr. Highfield, an SCNM alumna and department chair of our 9 extended community sites, and a current student, Amani Owens-Bailey. Once again, thank you for attending our webinar. We hope you find this presentation both interesting and informative. And with that, let me introduce our presenters. Dr. Jan Highfield is a graduate of SCNM, where she completed a 1-year residency with a focus in family practice. She is professor and department chair of community medicine, which include our 9 clinical extended sites. In addition, she trains students at these community sites where we treat underserved families and addiction recovery patients. Dr. Highfield is a supervisory physician at the Southwest Naturopathic Medical Center and is medical director and supervising physician at Hamilton Elementary School Clinic, which is an extended site here in Phoenix, Arizona. Dr. Highfield has been the primary investigator on studies with the Southwest College Research Institute. She completed postgraduate training in environmental medicine, IV therapy, and has a certification in chelation therapy. She maintains a private practice at Southwest Naturopathic Medical Center. Therapeutic modalities include nutrition, botanical medicine, homeopathy, and tissue cleansing in the treatment of endocrine and GI disorders, chronic fatigue, and environmental illness. Our second presenter, Amani Owens-Bailey, hails from Washington, D.C., where she grew up, did undergrad and grad work, and had a career in adult education before coming to SCNM. From a young age, Amani had an interest in science, health, and education, nurtured by loving, supportive parents who encouraged her participation in science fair and science projects at home. Amani spent three of her childhood years in the southern African country of Swaziland, where she was first exposed to the concepts of community medicine from the health presentations of Peace Corps volunteers, and her fascination with a copy of Where There Is No Doctor on her parents' bookshelf. The interest in community medicine and health education led Amani first to get a graduate certificate in global health from George Washington University, and then led her to SCNM to blend her love of community and global health with natural medicine. While at SCNM, Amani has been a TA for the physiology lab and for hydrotherapy, and also the school's NMSA rep to AMSA and the coordinator of AMSA's Preventative Medicine Interest Group. She's also had the opportunity to do medical volunteering in Mexico through Naturopaths Without Borders and in Haiti through Mama Baby Haiti. She believes that the skills gained at SCNM will allow her to further her ability to positively impact the health of communities back home in Washington, D.C. and the world over. Thank you both, and now I'll turn it over to Dr. Highfield to begin our presentation. Thanks, Dr. Highfield.
Thanks, Eve. Hi, everybody. This is Dr. Jan Highfield. I'm pleased to be here today to share with you information on our community medicine site. I've been involved as a physician at our extended site clinics for about 12 years. I've also lectured in the classroom for about that same time. I began in the community clinics as a resident at one of our substance abuse centers, and then continued in family medicine and family practice at some of the clinics around the valley. I've been department chair of the extended site clinics, that means our community clinics, for the past 5 years. As we get started with our presentation, I want to talk a little bit about natural medicine. Eve introduced the basics of naturopathic medicine, but as a practitioner for this period of time, I can share with you the efficacy, the long-lasting health effects that we can have with our patients. And let's go to the next slide. Naturopathic medicine treats the whole person and seeks to find the root cause of disease in order to improve health. Naturopathic physicians treat and educate patients, empowering them to take charge of their health and live happy, productive lives. In relationship to community medicine, I like this comment. The physician is obligated to consider more than a diseased organ, more than even the whole person. He must view the man in his world. SCNM has been providing medical care through community teaching clinics for the underserved populations for more than 18 years. At these clinics, we see children and families, domestic violence victims in recovery, individuals battling HIV, AIDS, and individuals working to recover from addiction. And they all benefit from naturopathic care. These community teaching clinics are staffed by naturopathic physicians. These physicians are part of our clinical faculty. Third and fourth year clinical students rotate through the clinics, giving them the opportunity to gain skills and experience in the fast-paced community medicine setting. And I say this is fast-paced. Our usual clerkships or rotations are about in 4-hour blocks. We can see anywhere from 10 to 20 patients in that period of time. And it's just a wonderful medical experience for everybody. Hamilton Elementary School Clinic is one of the clinics that serves community medicine in the Murphy School District. The Murphy School District is made up of 4 elementary schools. We've been in operation there since 2002. The school health nurses would refer students to us, and then our doctors would see them and start the process. This clinic now sees over 2,000 pediatric and adult visits a year, providing basic labs, pharmacy, nutritional supplementation, natural therapies, naturopathic medicine. Here's a picture of the waiting room. When we started in 2002, we were in just one big open area that the school had given us. We would haul in our medical supplies and supplements for the day, and we'd see patients in little sort of office cubicles. It worked. We delivered good medicine, but we were lucky enough that through grants, through collaboration with the school, through the Rotary Club, to do a remodel of this area. We now have a clinic that has 5 exam rooms and waiting room, receptionist room, and a conference room. We also have an in-house lab in the clinic where we can do on-the-spot glucose, hemoglobin, UA testing, strep testing, so that we're able to diagnose that patient and treat them in the same visit for acute care. We're provided with supplementation from our grant and also from donations. So we do, like I said, full-service naturopathic care here at the clinic. This is where you would, as a student, consult with your doctor, do case review, go see your patient, come back, and start to develop a plan for the patient case. At the community clinics, we see a variety of acute and chronic disease. We like to say that we see a lot of pathology, and in a medical student's eye or a doctor's eye, that's really an excellent experience. Regularly, we're treating diabetes, hypertension, acute upper respiratory tract infection, GI complaints, thyroid disease, acute ear infection, seasonal allergies. And as I like to say, we treat it with seamless integration with modern and traditional medicine choices. Urgent and acute care needs come our way, and we prepare you and our doctors to be ready to encounter cardiac and vascular urgent events. Contusions, injuries, broken bones. Amani will be sharing a case of an urgent care patient. And I can remember, just as an example, one case where a female patient came in on crutches one day to the waiting room. We brought her into the exam room, and she had an air splint on her lower extremity and had broken the distal part of her fibula, and so she had been put in the air splint, given some pain meds, and said, well, there you go. She wasn't real clear on what needed to happen, but what needed to happen is she needed to be splinted or put in a walking cast. And so while we weren't able to do that at that visit, we referred her, gave her options where she could get that care so that could continue. And then, of course, we encouraged her to come back and see us so that we could assess her progress, and she did very well. Mental and emotional issues are seen and treated using the whole patient model, which views mental health as important as the total clinical picture. Naturopathic medicine really shines in that area, and we understand that all parts of the whole need to be addressed so that a patient can be well. We strive to create a medical home for the patients so that all their needs are addressed, and when referrals are needed, the support care continues. The patient comes back and checks in. We're doing all the therapies that we offer. The patient feels that this is where they get their questions answered and begin to experience better health. Naturopathic medicine has many different tools. You may hear the term modality or treatment modality. Student clinicians learn all those, but they also learn to work simply, effectively, and use them in the therapies. So looking at some of the populations we treat, some of the places we are out in the community, community schools is and school clinics are one of those places you'll find us. It just makes a lot of sense that getting somebody early, treating young people with naturopathic medicine gives them the opportunity of lifelong health. When existing health conditions can be discovered, when the necessary medicine, nutrients are applied, and lifestyle changes with positive eating habits and exercise, they can be the best they can be, and that's where we want to start. Also, learning challenges such as ADHD, behavioral health issues can often be addressed naturally along with physical complaints, and then once again we create well kids. So here's a picture of some happy guys. Family medicine. You can become a great family practitioner if that's your desire. You can specialize, but we turn out great physicians, and so the community medicine sites are great places to learn. After a few years of treating just the pediatric patients at Hamilton, we decided that seeing the whole family might be a great idea. That way everybody is on the same page at home and working towards healthier participants. We provide care at 2 clinics in association with a domestic violence shelter in the Phoenix area. Women and children who have suffered domestic violence need special care. They need to begin to understand that the physical recovery and the mental emotional healing is all important. This is in November of 2011. We remodeled, along with collaboration of the center, a second clinic. And this is the waiting room of the clinic. It's warm, it's pretty, it's cheerful, it's safe and comforting. This clinic has 3 standard exam rooms and then a larger family room so that we can see folks together. And once again, a great environment, a great experience. As I said, some of our clinics are wherever they can be. It could be in a church gymnasium, school gymnasium, a church meeting area, but the quality of care and the skill that you will learn there are all the same. Substance abuse recovery, we are at 3 locations in the Valley, helping those recover from alcohol and drug abuse. It's specialized care. It's widely understood now that through research, neurological, genetic, environmental factors all play a part in the disease process, and then we recognize that all of these can play a part in the recovery. It's a very interesting subject. I've had students say, well, you know, I'll probably never practice in this area. I probably will never treat recovery patients. But when they have the opportunity to be face-to-face with a patient and realize that this person is working above all odds, that in their life they may have lost their career, their family, and often to some extent by their own hands, and coming to that place where they say, I can move on, I can feel better. It's very, very gratifying to be a partner in that relationship through nutrition, through neuro supplementation, through the energetic therapies that we use, acupuncture and homeopathy. A patient can get on their feet and decide to progress. SCNM physicians and student doctors established one of the first clinics for patients with HIV approximately 12 years ago in the downtown Phoenix area. Naturopathic medicine provides vital support for these patients with nutritional counseling, planned supplementation, treatment of the side effects of the disease, and also the antiviral regime improves quality of life. We now say that the patients are living with HIV, whereas 12 years ago it was more the opposite effect. As I was saying, the energetic modalities of acupuncture and homeopathy are often case changers. When those are applied and applied appropriately, all the other therapies begin to work better. The patient begins to feel better, and that quality of life and that opportunity is what we look for. So that's a little overview of our clinics, and I hope you enjoyed it, and I hope you'll have questions for us. I want to talk a minute about what we've done in the curriculum. In 2010, SCNM dedicated itself to revising, reimagining its didactic curriculum. This included not only the basic sciences, but also the didactic clinical training. You may have heard, if you've been talking with our folks here at SCNM, that you begin your training as a doctor day one. We have a clinical practice or the art of medicine class that you'll begin. Within this class, we've embedded units on cultural competence in medicine. This is a very important subject. In medicine, it's important to examine one's own cultural beliefs and communication styles. It needs to be deliberate. It would be nice if we could say, well, you know, I'm okay, you're okay, I'm a nice person, and I care about everybody, but your skill level needs to be at that place where you're ready for anything, and you're also the direct conduit for communication with your patients and the direct supporter. Medical students in training are part of a cultural group. You'll be here for 4 years with your class and classmates. You'll be training in physical exams, differential diagnosis, objectivity in medicine, and you also need the capacity to assess yourself and to be ready for the role that you're going to take on. This leads to this statement, which is, I think, the most powerful statement, is that every patient encounter is a cultural encounter. The doctor, the patient, each brings different experience, different characteristics. And so this works for every event that you will have in your profession. Every patient encounter is a cultural encounter. Culturally competent medical providers develop skills for exploring the existence and the importance of differences, basic assumptions, expectations, and goals that they and their patients bring to the table. Some examples in CLPR 5020, which is the name of the Art of Medicine class, like I like to title it. There's 16 hours of lecture and about 8 hours of lab dedicated to cultural competence in medicine. This is required. This is not just an elective that you can take if you have interest. This is required because it's core training for you. Public health lectures are also embedded into this curriculum to discuss infectious disease, travel medicine, and disease reporting, which is important when you'll be in practice and private practice also. All these skills, I need to reiterate, are actually things that you can take to your private practice. You don't have to have just an interest in community medicine. This is live, excellent medicine. One point that we go over, and you'll learn important things about working through an interpreter, assessing your patient so that you understand what their communication needs are. They can be a different language, they could be need for sign language, and being able to find the resources and apply that element that will support the communication. In our later class in the second year, there's also 24 hours broken in between lecture and lab, but we go in depth in the training for challenges for the patient populations that we see in community clinics, also including care of elderly, homeless care, other groups that can really benefit from naturopathic medicine. Along the way, we also prepare you for global medicine service. There's a great interest and great need in that area, and we want you to be prepared so that you can serve. So that's included in this course. The lab in this class includes an interactive project in developing culturally appropriate and economically nutritious meal planning. This is just an excellent experience, and the students have really stood to the challenge of this. They will be breaking into groups in the lab, having a scenario of a family, a low-income family, cultural definition of that family, the group, sometimes the pathology in some of the members. And then they are to develop a meal plan for a week with meals and snacks that work into the economy of that family, that work into the location. Many areas, 14% of Arizona families live in food deserts. These are places where they don't have access to fresh produce, fresh foods. And so that is also identified as a challenge in this project. There's presentations, and there's just a great amount of exploration and learning that takes place in this exercise. So I'm also happy to share that with you. So to end, this is a quote from John F. Kennedy, and we all live here. We all care about our children. We all share the same environment, and so we want to understand that and nurture that. Thank you. I will now pass the portion of our webinar over to Imani.
All right. Greetings, everyone. My name is Imani Owens-Bailey, and I'm a fourth-year medical student here at SCNM. And I'm really honored to be a part of this webinar, and I thought I'd kind of share my experience with community medicine and kind of give you a student perspective on just the impact that participating in our community medicine clinics has had. There is a saying, and I'm not sure who said it or where I heard it first, but the saying says, through learning you will teach, and through teaching you will learn. And I feel that statement is so powerful, and it really speaks to the experience of working in our community medicine clinics. We as students go into the community medicine clinics, and it's a learning process for us. We are doing our clinical rotations. We are learning about patient care. We are learning to help our patients to reestablish their health. But in doing that, we also have the opportunity and indeed the responsibility to teach our patients the things that they need to know so that they can really have control over their own health and wellness. So there's a lot of patient education that goes on. But as we are learning and then teaching our patients, then we're also learning from them. We are learning a variety of things. We are learning how to do parts of intake in Spanish. We are learning about different cultural diets. We are learning about just family dynamics. So there's a lot that we really learn through the community medicine experience. Some of the most valuable things that I think we get as students from the community medicine experience are in probably four main areas. And the first main area is that we get a chance to see naturopathic medicine at work in the real world. Here at SCNM, we have a wonderful medical center where we do rotations. But I think it's also valuable for us to go out into the community and see patients that maybe we wouldn't see at our medical center. We encounter patients for whom we are their primary health care providers because for whatever reasons they're not able to otherwise access the health care system, whether it be low income, whether it be addictions, or a variety of other things. And so we see a lot of conditions that don't necessarily walk into our medical center. It's also an opportunity to practice cross-cultural communication skills. And, you know, at a lot of our centers, at a lot of our community medicine clinics, we have populations that for whom English is not necessarily a first language, and so learning how to navigate that dynamic, the importance of speaking directly to the patient, even if an interpreter is translating for you, because you are there to provide for the patient, and so maintaining that eye contact, even if someone else is translating your words, and that's always a challenge, especially when you first start in the clinic. So by the time you've done a few community medicine clinics, you are pro and have no problem, you know, getting that eye contact with your patient, despite the fact that there's a third party in the room who's translating. You also get a chance to have building your cultural competency skills, learning the different types of things that are appropriate based upon the culture of your patient, what recommendations you can make. You have to pause to think about what type of things you're going to recommend for a diabetic patient who has a particular diet. Think about, okay, so what types of things really make up this patient's diet, and is this recommendation something that is even going to be feasible? Are you stuck in your own perspective? So getting out of your head and experiencing the culture of others. And lastly, what I love about it is that you can encounter the world. We see a wide variety of patients. Here in Arizona, we see in our clinics a lot of Mexican families that come in, but we also have a variety of Native American patients that come from the nearby reservations. One of the neat things for me has been learning how to read and interpret a Mexican vaccine card that some of our kids bring in at the Educare clinics. But then we see patients from even further afield. I've had encounters with Somali mothers and children, and even a patient from Brazil. So you really get a chance to encounter a wide variety of cultures in our community medicine clinic. What I thought I'd do is I'd share a few cases with you to kind of give you a better perspective on the different types of things that we encounter in our clinics. Let me talk to you a little bit about Yolanda's case. Now, Yolanda was a 19-year-old woman who came in after she had been to the ER. She had been in an accident with a quad vehicle. It flipped, and she sustained a knee injury. It turned out that she needed 20 stitches in order to kind of close the flap of skin that was sheared off in the accident. And she was given the directions from the ER to then go see her primary care physician for continued evaluation of the wound and eventual stitch removal. Well, where did she come? She came to see us at the Hamilton Clinic. And so at her first visit, I got a chance to assess and evaluate her for potential infection. And then we scheduled her for the next week, and we actually got a chance to remove her stitches and then ensure that her wound remained closed with steri strips and a variety of other things. And we even gave her a little kit of things that she could take home with her for continued home care. And so that's an example of an acute case that walks in the door. You never necessarily know what's going to come in the door at the community medicine clinics. And so you better be up to the challenge. The next case I want to talk to you about is a case that was kind of more of a chronic case. And this, in fact, was my very first case that I saw when starting community medicine during my rotations. It was a 45-year-old Mexican woman who came in for weight loss and knee pain. And when she first came in, she was 375 pounds, and walking was just agony for her because of the knee pain due to the excessive weight. And she was a little bit leery of kind of what we could do for her and how we would treat her. And so we started off with acupuncture. Acupuncture is really great for helping with chronic pain. So we did acupuncture. We even did some homeopathy with her. And we saw her every single week. And over that time, we kind of built up a trust with her. And so we did those things for a long while. And that was at the beginning of my clinical experience 2 years ago. 2 years later, I'm back on the same community medicine rotation, and it's just amazing. And I'm, again, having an opportunity to work with Maria. She's lost over 135 pounds. Her knee pain is fully resolved. Once we really have concentrated on building the trust with her, then she was open to even hearing about dietary changes and the other things that we could work with her on to help her to manage her weight. And now at this point, she comes in for continued weight management, but she also brings along other family members. So we have built trust and care for her, and now care for her extended family as well. So I believe that's a really great testament to the work that we're doing in our community medicine clinics. Some of the things about cultural competency. There's the question of the veil, I like to call it. So it's the case of Decca. Decca was a little 4-year-old Somali girl who came in with her mom, and she came in wearing a sparkly, beautiful head covering called the hijab. And she came in for an earache and a fever. And there were 2 students on the shift, myself and another student who happened to be a male. And the questions that we had would, Mom be okay with her daughter being treated by a male student, you know, in terms of the Islamic culture and dealings with men. And then the other question was, would it even be appropriate? In order to treat her, we need to be able to visualize the ear. She's wearing the hijab. How could we navigate asking Mom if it would be appropriate to remove the hijab in front of the male? And so those are the types of things that you have to consider. And those are the things that, you know, you really become aware of when you are dealing with other cultures and questions that you have to ask before you just go in and do care in the way that you would maybe do without thinking twice. And so there are questions to be considered and answered. Another case that I want to talk about is Inez's case. Inez was a 38-year-old Mexican Indian woman who came in and she'd had really prolonged menstrual bleeding. Her menses had lasted for 15 days for every month for a long period of time. And so there were naturally concerns about anemia, concerns about why she was experiencing this menorrhagia, and then what we could do for her. So there are kind of 2 different components that we look at with a case like this. We look at acutely, how do we stop this bleeding for right now? And we chose to use the Chinese styptic Yunnan Baiyao, which kind of stops the bleeding for the immediate period of time. But then you're also looking at long-term, what can we do with this patient? So that involves a plan of supplementation to kind of ensure her continued health and wellness. But then it also involves, okay, so our patient is coming to us. She doesn't have access to other types of medical care, doesn't have insurance. How do we then navigate the system so that she's able to get assessed for the cause of this menorrhagia, being able to provide referral to her so that she could go and get an ultrasound to assess for fibroids and other causes for her abnormal uterine bleeding was also a major part of dealing with her case. And so I really appreciate that in our community medicine settings, that it's not just the acute care, but it's the long-term care and management and referral system that we get experience with it as well. In our community medicine experience, especially at the Hamilton Family Clinic, we deal with a lot of diabetic patients. And so I entitled this slide Ashuka, meaning sugar. This is diabetes care. And so we learn kind of some of the standards of good long-term care for our diabetic patients. And so over the course of my time there, I've gotten a chance to do things like use our in-house lab to test blood sugar on the spot. I've learned about being able to prescribe metformin and glucometers for our patients. Learned about supportive supplements that really help a patient in being able to maintain blood sugar control. And we've learned about the importance of really empowering patients, allowing them to track their blood sugar through the use of glucose logs so that they can see the efficacy of the changes that they're making in their lives, the efficacy of the treatment with metformin. And so that's been an important part of my community medicine experience as well. So for me, what are the take-homes from community medicine? The take-homes for me are getting a chance to do real-world medicine and see cases that I wouldn't have ordinarily maybe seen in our medical center. Practicing and honing cross-cultural communication and cultural competency skills, and then getting a chance to encounter the world right here in our local area. So thank you so much for letting me have an opportunity to share my experience with community medicine. I'm going to hand us back to Eve now.
Great. Thank you both so much. That was such wonderful information. And at this point in the webinar, we'd like to open it up for questions. And we do have a question that I will turn over to Dr. Highfield. As a naturopathic doctor, are you already trained to work with the people in the domestic violence and substance abuse recovery program?
As we develop and solidify the curriculum for this department, that's an important part because there are some specialized training options for patients with domestic violence experience, and so we're striving to bring our doctors and bring our students into that level of learning so that we are giving appropriate care, that we have the best skills necessary for that experience. So excellent question.
Great, thank you. And just as a reminder, if you have a question, you can type it in the question box on your control panel. And this question, I think, can either be for Imani or Dr. Highfield. How does a student pick which extended site they will do their rotations at?
I guess there are kind of two options. When we are trying to figure out what rotations we want to do for the next quarter, we are allowed to request a particular type of shift, and so we can put our preferences on our rotation request sheets. But also there's an element of chance and kind of serendipity to it as well. You don't necessarily get what you request, and sometimes you get rotations that you haven't requested. And so my very first rotation ended up being a community medicine rotation. And I didn't specifically request that rotation, but it ended up being the best rotation that I could have gotten at the time because it kind of started my love for community medicine. But since then, I have made a concerted effort to request a variety of different community medicine shifts, both the Sojourner domestic violence rotations, the Hamilton rotations, as well as the Educare integrative pediatrics rotation.
Yeah, and if I can add to that as far as your rotations, your choice, or the serendipity of either. In our continual improvement for curriculum, especially clinical curriculum, I've been on the committee for building the clinical curriculum. And what our ideals and objectives are is that you get some good general training, and then you have opportunity for what we call selective. So that's your choice portion of your rotations, where you do have some choice on where you want to be. And as you develop through the 2 years of clinical training, you'll have more choice as far as if you want to specialize, if there are certain modalities or areas that you really want to focus on. But we are producing good general physicians who then also will become specialists in their area of interest.
Great, thank you both. All right, then we have another question that says, I read that MDs only do minor surgery, which yes, that is correct, but the question is, what is considered a minor surgery? I'll let either of you tackle that one.
Minor surgery is defined as surgeries that take place outside of any major body cavity. So if you're pre-med students, you're understanding those terms. But we do excisions and incisions of minor skin defects, and so it manages to give you the skills for a general family practice type setting where you might want to be that full service doctor who removes skin tags or assesses a skin lesion, toenail removal as needed, things like that. So removing stitches, placing stitches, those are all the skills that you'll get, and it really does serve you well as a family practitioner.
Great, thank you. And then I know you touched on this a little bit, but a little bit more clarification about when you start clinical rotations in the medical center and then in the outreach clinics.
Well, since there's 9 extended site clinics, there's a variety of experience need for our students. Some places you need to hit the ground running, and so we'll be requiring that you have some experience in the clinic, that you're not what we call a newbie. It's not your first day in clinic, but that also has happened in the past. So you can have a variety of experiences. You will start out with 2 rotations basically in your first quarter of clinic. I believe it's the 8th quarter now. And one could be in the medical clinic on campus. One could be in a community clinic where you're able to follow, to explore, to be that secondary doctor. It's important to have that experience to be able to sit back and watch. You learn so much by experience. I say you never put your medical learning into practice until you're sitting in the room with the patient having that visit experience. And so we're very attentive that you get the right amount of experience and you're ready for the challenges that we'll be offering you.
Great, thank you. Another question about the training that students receive regarding mind and spiritual counseling. Can you talk about our mind-body work a little bit?
Okay. As part of, I guess, our academic and didactic classes, we do have a variety of mind-body classes that, and it's almost started even from year 1, emphasizing the importance of the impact of the mental, emotional, and spiritual state on physical health. And so throughout the curriculum, there are a variety of classes that kind of move you through a progression of different skills that you can utilize in terms of mind-body medicine. And then it's really integrated into your clinical experience. And so when you're in with a patient, you're considering not just supplementation and not just referrals, but you're also considering the mind-body, kind of almost every time you're with the patient. So it's really kind of fully integrated into the experience of providing patient care.
Great, thank you. We have another question about the kind of clinical research opportunities that SCNM offers. This particular student is interested in oncology and genetics, and I will begin by saying that we did have a specific webinar about our research program a few months ago that you can find on our website in the Webinar on Demand series. So that will give you a lot of information about our research program. But I don't know if Dr. Highfield or Amani, you have anything that you'd like to say about our research opportunities here?
Yeah, I will talk about that a little bit, in that our opportunity is vast. Just because we have had clinics and we have patient information, we have information we could mine to be able to do reports. That's one opportunity that I am very anxious to approach, because we see our medicine in action, and now we want to illustrate that. As far as our research program, yes, I'd refer you to the webinar, but research in naturopathic medicine and beginning to publish. Anybody interested, please come and see me. Please talk to me. We can put together projects.
If I could add to that, in terms of the research experience here at SCNM, also typically at least once or twice a year there is a research night that's put on by, I guess, our research department here, where the school and the community at large has an opportunity to kind of get a bird's eye view on what's going on in terms of the research that SCNM is currently participating in. And in the past there have been research presentations done in conjunction with ASU's Biodesign Institute. So there are a vast array of opportunities for students to participate in research and be exposed to the research being done here at the school.
Great, thanks so much, Amani. We have another question regarding residency programs after the 4-year degree to equip students to practice as NDs. And I'll go ahead and say that residencies are not required for naturopathic doctors as they might be for MDs, but we do have students that participate in those in residencies. I would say on average about 15% of our graduates go on to residencies. There are a limited number of them. They are pretty competitive, but the ones that do go through residencies find the experience to be quite valuable. I don't know if Dr. Highfield or Amani, you would have anything else to add about residencies?
In terms of, I can just speak to my encounters with the residents during my shift at the SCNM Medical Center. Quite a few of the shifts have had an attending physician and a resident as part of our, I guess, the clinic staff supervising the rotation. And so the residents are helping the attending physician to kind of manage the flow of the shift, but they're also providing support and guidance to us as students as well. And so that experience, I think, for them is an opportunity to improve their patient care skills, but also an opportunity to be involved with the education of the next generation of naturopathic medical doctors as well.
Great. Thanks very much, Imani. Another question for either of you. Are botanicals, physical manipulation, and acupuncture taught and used in the clinics?
Yes, absolutely. It's core. You'll learn. You'll have didactic classes on those subjects, extensive hours on those subjects, and then, like I said, in clinic, this is where you begin to practice under the supervision of your attending doctor, and they're core. They're really our tools that make our medicine. So, thank you for asking that.
Great, thank you. And along those lines, and again, I think you touched on it at the beginning of the presentation, but Dr. Highfield, or actually either, if you'd like to take this one, we have somebody who's listening in who is from Switzerland and is a prospective student for the naturopathic program and is wondering what the significant differences are between NDs and MDs.
Well, I can tell you about the differences. I want to talk about the similarities for a minute, in that we're all interested and know that the patient comes first, and so that is really where our true interest lies. And so when we have integrated experiences and relationships with medical doctors as a naturopathic doctor, that's really what's put on the table, that the patient is first, and we have our tools and skills. Medical doctors have their tools and skills, and I mean, I'm not going to use the word medical as the difference, because we're naturopathic medical physicians here in the state of Arizona. So differences, I don't want to separate or alienate to some extent. The wonderful thing about our training and you as becoming a licensed naturopathic physician is that you understand the total scope of medical care. You've been trained in pharmacy, you've been trained in pathology, you know what's going on when your patient comes in and says, you know, this is my medical history, this is the medications I'm on. You're able to take it from there. You're able to help them advise and advise them, give them options to how to improve their care. You're able to use all the modalities of treatment with that patient. So I think most of us in the modern world understand the standard medical paradigm, but I just want to say that naturopathic medicine is all-inclusive, and you'll be thankful that you're trained here because you have an excellent scope of practice in those areas.
Thank you very much. Well, that concludes our portion of the question and answer session. There was also a question about receiving a copy of the PowerPoint slides from this presentation. So just shortly after this slide, I'll share my email. So if you'd like to receive a copy of the PowerPoint, please email me and we'll send that to you. But in addition, this webinar has been recorded, and if you want to go back and watch it later, you will be able to do that. If you are interested in learning more about the admissions process, I encourage you to, again, email me or check out our website. And if you had other questions that didn't get answered during today's webinar, again, please send me an email and we'll answer those as best as we can. So again, on behalf of SCNM, I'd like to take another opportunity to thank Dr. Highfield and Imani for their wonderful and very informative presentation. And thanks to all of you for joining us today.